ACK Masaba Dispensary is located 5 kilometers from Butere town in the heart of Western Kenya. The dispensary serves residents of Masaba village and its environs. Prior to its inception, villagers had to walk more than 8 kilometers to get to the nearest hospital in Butere town.
Hapa katika eneo hili tuko na hii dispensary ya Masaba ACK ambayo inahudumia hawa watu karibu wote, kwa sababu health facility ambayo iko hapa karibu ni ya Butere District Hospital na iko kilomita nyingi sana kutoka hapa, na pia tuko na Manyala Sub District Hospital ambayo pia iko kilomita nyingi kutoka hapa. Kwa hivyo inafanya watu wengi hawapati huduma, na ndio sababu kuja hapa kuhudumiwa. Kwa hivyo hii ni facility ambayo ni mzuri kabisa na inasaidia watu wa hapa.
The dispensary's vision is to provide quality and affordable healthcare to the community. However, lack of water and electricity, as well as medical facilities and equipment, hamper the realization of this vision. Water poses a major challenge to the dispensary as it lacks constant water supply. The dispensary has one water storage tank that harnesses rain water. But the water stored is not enough to meet the dispensary's needs.
Or the running water for use, because when you want to do some cleaning, you need to clean water, you need water for drinking. So if we get water around, we have a borehole or running water, just one which is from the tap, it is cheaper.
We have a problem with water. We only have one tank in the compound. Now this tank harvests quite a good amount of water during rainy seasons, but during drought, the water is already used and out of stock. So at such times, like the months of November, December, January, and February, the nurses really have a rough time because without water, the compound cannot be kept clean. The dispensary must be mopped every morning, and then we need water to clean a few things like bottles to put in medicine for patients. Without water, we are really finding it rough. So it would be our request that we get a borehole. If we got a borehole within the compound, it would really assist us.
Another challenge the dispensary faces is lack of electricity. Electricity is vital to ensure smooth running of laboratory machines and general running of the dispensary. Electricity would enable installation and use of much needed medical machines and equipment, which would increase efficiency and aid in diagnostic services.
Some drugs which you are supposed to put in the refrigerator, especially immunizations. They are supposed to be in the refrigerator. We also have to have like the snake and rabies, and for snake bite, they are all supposed to be in the fridge. And even if you are for diabetes cases, insulin, you also put in the refrigerator. So we need to have electricity for that purposes. Yeah, we also need to have the maternity side, and when we have maternity side, we are also supposed to have the inpatient where we are supposed to deliver even at night, and then if there is no electricity, it is not possible.
If we get electricity, is very good. It can really assist us because there are some things whereby they are operated to using the electricity. There are some which we cannot use the solar, so we must use them. It will also assist us also in lighting, because looking for if we get the patients to admit at night, it's good to have the electricity other than the ordinary lights that we are using. The dispensary is located not very far from Mahondo. Mahondo is just across about 3 kilometers, and there is electricity within the shopping center at Mahondo. So if the electricity would be tapped to reach Masaba dispensary, then we would be grateful, because by so the nurses would be able to make use of the electricity well, even at night while treating patients.
The management and staff of Masaba Dispensary are appealing for aid from donors who could partner with them to help realize their vision of providing quality and affordable healthcare to the residents of Masaba village.